Alright, so I'm going to do manual ventilation of my patient with an oral airway placed. So I'm going to come into the room, I'm going to introduce myself and my department and briefly explain what's going to be going on with this patient. I'm going to make sure that I get my hands washed and then I get my gloves on. I'm going to be assessing the patient. Alright, so what I'm going to do first is I'm going to put my patient in the chin tilt position. So I'm going to use my fingers under the chin. I'm going to just tilt the head back to open up the airway. Next thing that I'm going to do is insert the oral airway. And so to insert the oral airway, the first thing we need to do is make sure that we have the correct size. So you measure from the tip of the mouth to the jaw. And then to insert it, you're going to insert with the tip side up toward the soft palate. And then once you get to the back, you're going to rotate 180 degrees. And this will rest against the patient's lips. You need to make sure that you don't end up pushing the tongue so that it occludes the airway. So I'm going to go ahead and insert my oral airway. Okay. And then I'm going to be checking my patient for their breath sounds, their pulse, and assessing them. I'm going to hook the oxygen up to my Ambu bag, and it's going to fill the reservoir side. And I'm going to get a nice firm seal on the mask, and then I'm going to begin to ventilate my patient manually using the Ambu bag at 12 to 20 breaths per minute. And I'm going to continue to assess the patient for their pulse. I'm going to be looking for lung expansion, which if you look right down here, you'll be able to see the rise and fall of the lungs. And then I'll continue to manually ventilate this patient as long as necessary. If for some reason the seal would slip and I wasn't getting that good lung expansion, I would readjust my patient's head and readjust the seal of the mask, and then I would continue to ventilate until we decided what the next step would be. Of course, I would be continuously assessing my patient during the time of manual ventilation.